epidemiology and risk factors of your bacteremia and bloodstream infections. So the epidemiology typically depends on the source. It could be like urinary tract infection where it can result in E. coli bacteremia, or some host risk factors are there. So it can be healthcare exposure that can like result in certain infections, or it can be geographical region that can influence like what infection that you're dealing with, or it could be the antimicrobial resistant rates in your hospital as well. It could be MRSA or MDR pseudomonas. All these things based on a local AMR, antimicrobial resistance rates. And the most common, this is a very important point for exams also, the most common organism that's going to cause bacteremia in the world is going to be E. coli. The second most common organism that's going to cause bacteremia in the world is going to be Staphylococcus aureus. This is the second most common. But overall, most common organism is going to be E. coli as a source of bacteremia, and followed by Enterococcus species. These are the three most important, but I feel like E. coli, Staphylococcus aureus are going to be the most important. And what are the risk factors for developing bacteremia? Too young, too old. Both are going to be risk factors. Presence of any form of comorbidities, especially immunosuppressive state, like for example, diabetes, COPD, chronic liver disease, CKD, malignancy, alcohol abuse, all these things are going to be serving as risk factors of bacteremia. And as I said, immunosuppressed state, immunocompromised state, like HIV, AIDS, steroid use, transplant patients, neutropenic patients, post-plenectomy patients, all these patients are also at risk of developing bacteremia. Suppose if the patient is having a barrier disruption, like for example, what do you mean by barrier disruption? We have natural barriers like skin, mucosal membranes, and all those. If you disrupt them by introducing an IV catheter, so you're disrupting the natural barrier. Or in patients who are intravenous drug users, or patients who are having burns, mucositis, wounds, surgery, trauma. In all these conditions, you're disrupting the natural barrier, especially the mucosal membranes, the skin. So these are disrupted. So bacteria can enter through these areas. So that's usually going to be the risk factor. So age, comorbids, immunosuppressed state, barrier disruption. You can split into four: age, comorbid status, barrier disruption, and immunocompromised states. These are going to be the risk factors for infection. So remember, which are going to be more dangerous, your gram positive or gram negative organisms? Always it's going to be gram negative organisms that are very dangerous because they produce beta lactamases. Gram positive, at least we have something to do, like Vanco, Dapto, Linazol, it's something we can give. But when it comes to gram negative organism, they produce different beta lactamases, which gives a lot of headache in practice.